Welcome to my YouTube channel Pathology Decipher. In this video, we are going to learn about gangrene and pathologic calcification. Gangrene is necrosis of the tissue associated with superadded putrefaction. Most oftenly, the coagulative necrosis is followed by the gangrene due to ischemia. Inflammation can be seen in this type of gangrene. There are two main types of gangrene, dry gangrene and wet gangrene, and a variant of wet gangrene is gas gangrene. In all types of gangrene, necrosis undergo liquefaction by the action of putrefactive bacteria. Next, let's see about dry gangrene. It begins in the distal part of the limb due to ischemia, and the typical example for dry gangrene is the toes and feet of an old patient due to severe atherosclerosis. Other than ischemia, there are many other causes for the dry gangrene like Raynaud's disease, trauma, ergot poisoning. Usually, the dry gangrene is initiated in one of the toe which is farthest from the blood supply. Then the gangrene spreads slowly upwards until it reaches a point where the blood supply is adequate to keep the tissue viable. The line of separation is formed at this point between the gangrenous part and the viable part. The line of separation is seen in the dry gangrene. It is an important point. Let's see about the morphologic features in the dry gangrene. Grossly, the affected part is dry, shrunken, and dark black in color, resembling the foot of a mummy. The color is black due to liberation of hemoglobin from hemolyzed red blood cells, which is acted upon by hydrogen sulfide. The hydrogen sulfide is produced by the bacteria, resulting in the formation of black iron sulfide. As I have already said, all type of gangrene undergo liquefaction by the action of putrefactive bacteria. Next, let's see about wet gangrene. Wet gangrene occur in naturally moist tissue and organs such as bowel, lung, mouth, cervix, vulva, and etc. And other examples of the wet gangrene have clinical significance such as diabetic foot. Diabetic foot is formed due to high glucose content in necrosed tissue. The high glucose content will favor the growth of bacteria. And the next is bed sores occurring in the bedridden patient due to pressure on sites like the sacrum, buttock, and heel. The affected part is stuffed with blood which favor the growth of putrefactive bacteria, and as we have already seen in dry gangrene there is clear cut of line of demarcation, but in wet gangrene there is no clear cut line of demarcation. The morphologic feature of the wet gangrene are soft, swollen, putrid, rotten, and dark. The classic example for the gangrene, that is the wet gangrene, is the bowel, commonly due to strangulated hernia and intussusception. Here is a picture showing wet gangrene of the small bowel. The affected part is soft, swollen, and dark. The line of demarcation between the gangrenous part and the viable part is not clear cut, as in dry gangrene. Next, let's see about gas gangrene. It is a special form of wet gangrene caused by gas forming Clostridia. It is a gram-positive anaerobic bacteria. It gained the entry into the tissue through the opening contaminated wounds, especially in the muscles, or as complication of an operation on the colon, which normally contain Clostridia. The Clostridia produce various toxins that produce necrosis and edema locally and are also observed producing profound systemic manifestations. The morphologic feature of the gas gangrene is swollen, edematous, painful due to accumulation of gas bubbles of carbon dioxide within the tissue formed by fermentation of sugar by the bacterial toxin. The bacteria is the gas forming Clostridia, which is a gram positive anaerobic bacteria. Next, let's see about pathologic calcification. Pathologic calcification is the abnormal tissue deposition of calcium salt together with a small amount of iron, magnesium, and other mineral salts. There are two forms of pathologic calcification. When the deposition occurs locally, it is dystrophic calcification. In dystrophic calcification, there is no derangements in calcium metabolism. But when the deposition of calcium salt occur in a normal tissues, it is called metastatic calcification, and it is almost result in the hypercalcemic condition, and there is derangement in the calcium metabolism. First, let's see about dystrophic calcification. Dystrophic calcification is encountered in area of necrosis. Whatever the type of necrosis may be, that may be coagulative, caseous, or liquefactive, it occurs in the dying tissues, that is the area of necrosis. It can also be found in the atheroma of atherosclerosis, damaged heart valves, and during aging. Sometimes a tuberculous lymph node is virtually converted to stone. On occasion, single necrotic cell will constitute seed crystal that become encrusted by mineral deposit. The progressive acquisition of outer layer may create lamellated configuration called samama bodies. These are called samama bodies because of their resemblance to the grains of sand. And in asbestosis, the calcium and iron salts gather and form beaded dumbbell forms known as asbestos bodies. Next is the metastatic calcification. As we have seen that the dystrophic calcification occur in the dying tissues, that is in the area of necrosis, metastatic calcification occur in the normal tissues whenever there is hypercalcemia. There are four principal causes of hypercalcemia. First is increased secretion of parathyroid hormone with subsequent bone resorption as in hyperthyroidism. Next is the resorption of bone tissue and diffuse skeletal metastasis like breast cancer and accelerated bone turnover as in Paget's disease. And the third is the vitamin D related disorder including vitamin D intoxication or sarcoidosis where the macrophage activate vitamin D precursor, and it may also be idiopathic. The fourth is the renal failure which causes retention of phosphate leading to secondary hyperthyroidism. Like, share and comment. Do not forget to subscribe my YouTube channel. Thank you for watching.